We wanted to start and kick off this meeting and convening with this topic of air being an invisible pandemic. And of course, after this pandemic year, I think it makes even more sense. But we want to start this very first session on trying to understand better how air pollution impacts the health of babies, toddlers, caregivers, and people in general. And that's why we have two great speakers that are joining me today. We're going to have a conversation together. We really want this to be a space where our speakers can share with you different thoughts based on their own experiences of life, but also in all the great knowledge that they have on the topic. So I want to introduce my first speaker, which is Rosamund Kissi-Debrah. Many of you might already know Rosamund. She's been like a great advocate for health and air quality, but she's also the co-founder of the Roberta Family Foundation. And I want to highlight the mission of this foundation because it's quite unique. And I want to say that Rosamund's work during this last years has really been around improving the life of children affected by asthma in Southeast London. And she'll share with you her own personal story of why she's doing this. But I also want to highlight that Rosamund has been a key person to campaign for clean air as a fundamental right. As I was saying before, we don't always see this as a human right, but I truly believe this should become a right that we all start advocating for. And our other speaker is Carlos Dora, a dear friend. He's president of the International Society for Urban Health, a medical doctor and epidemiologist. Carlos Dora is from Brazil, and he has a distinguished career in global public health and environmental issues. Until recently, he coordinated the WHO global work on health impacts of sector policies, different sectors such as energy, transport, housing, extractive industry, and he also articulated a global response to air pollution. Carlos, I'm always impressed with the way that you share your knowledge and your experience on trying to implement guidelines and just kind of like follow all these policies that of course come from very high level, but you in a very humble way, you always have the time to share with everybody your experience and knowledge. So I'm really looking forward to this conversation. I really want to start just like giving you a couple of minutes to introduce yourself. So Rosamund, let's start with you. So maybe you can introduce yourself and just share with the rest of the participants who you are and what brings you here today.
Morning, afternoon, evening, depending on where you are. And thank you very much for joining us today and talking about this important topic. I am here really, I would say, because of my late daughter who passed away. In the United Kingdom, schools are returning for today and yesterday. So really, I should be in school teaching, but due to my late daughter's struggle, that's what brings me here for today. I am an advocate by chance. My first degree is in psychology, and my second specialism is in philosophy and ethics. However, this topic landed on my doorstep on 2010, when suddenly, during a break from school, my daughter suddenly began to develop severe breathing difficulties. And what ended up being, she ended up having one of the worst cases of asthma in the United Kingdom. The difficulty with the story was we didn't actually know at the time of her living what was bringing on all these asthma attacks. Lots of children have asthma. Unfortunately, we now know asthma is very, very common. But one of the most important things, which is important about asthma, is knowing what your triggers are. And unfortunately for us, we didn't know what Ella's triggers were. And sadly, we found out after she passed away. So last year in December, there was a landmark ruling in the United Kingdom, and Ella is the first person, as far as I know, in the world to have air pollution on her death certificate. For years, we've talked about numbers, Currently 8.8 million people, we say, die every year from air pollution, but there has been no face up until now. So that's what brings me here, and to help raise awareness, especially amongst young children, why the air that they breathe needs to be clean, because it can affect them from the cradle to when they die. So that's what brings me here today. So thank you very much.
Thank you. Thank you, Rosamund. And of course, your story is a moving story, and I'm always impressed with the story of Ella, but also on how the story of Ella has actually really created some awareness and has really like moved some decision makers to take action. But Carlos, I would like to turn it up to you and just give you a couple of minutes to present yourself and share some highlights of the work that you've been doing around clean air.
Thank you, Cecilia, and thank you, Rosamund, for being on this. In short, or very briefly, what I've come out as a doctor, a medical doctor, was working in primary health care in Brazil in the 80s, and got interested in public health and moved gradually from chemicals and environmental factors more broadly impacts on health to the public policies that create those risks to health. And I, with WHO and with other people, I work with transportation, with energy, with extractive industry, with a lot of stuff. And as you can see today, including air quality and clean air and how to get there. And I ended up in civil society as I am today. And I think it's just a sign of maturity, because having worked with where governments can contribute, where technical tools and analysis can contribute, I think really civil society has a very special role to play in transforming local environments. And I'm not saying that they're to blame for everything or they are responsible for everything. Of course, there's others who are responsible, but there's a key role that can be played in actually getting that literacy and that knowledge, that awareness, and the ability to put pressure in governments and private sector, and also to make their voice heard is quite important. So air pollution, I think, is really, and I'm very glad that Urban 95 and Bernard van Leer are focusing on this, because I think that it is a major cause of ill health globally, and I think we'll probably go a bit on that. In the amounts of evidence are really overwhelming. We have tens of years of, and we have tens of thousands of studies. We have demonstrated in minute detail the health impacts, etc. And yet, a lot of the action is still missing. So there's, a very interesting space there and a very interesting set of opportunities. But thank you for being with you. And I do believe that the urban actors who are around the table do have and can use this meeting and this convening opportunity to create further action and to engage. And we're at the Society of Urban Health, the Global Society of International Society of Urban Health. We're very interested in partnering with others and with you on this next step. Thank you.
Thank you, Carlos. And maybe let's start with a couple of questions, which I think it's the interesting part of why do we have like the profiles of Rosamund and Carlos, is because I think they bring like very different experience. So as you heard, like Rosamund's personal experience with her daughter Ella really created this commitment for herself on just like really advocating for the topic. But in the case of Carlos, I think you've also been like a great advocate to trying to convince these policymakers, people who are basically running and implementing different guidelines. So maybe, Carlos, let me start with you now. What kind of evidence do we need in order to convince governments or decision makers to take action now? What kind of evidence that works, and how, if you would have to go to a mayor, to a minister that really needs to enforce different guidelines, what kind of evidence works?
Well, I can tell you first what kind of evidence we have, and we have loads of it, as I was saying. The standard, the WHO standard, limit level of 10 micrograms per cubic meter of particulate matter was agreed on the basis of science already in 2005. So we have quite a few years that we have a lot of evidence, which is considered enough to take action. After 2005, we have much more evidence on heart disease and stroke, and much more evidence on brain function and brain, including on early child development, in cognition, and in the ability of children not only to learn, but in terms of behavior. You know, children who are exposed to air pollution have more hyperactivity, less cognition, less ability to develop. So that's, you know, quite well established. There's also animal studies on the brain that go much further, and you know, I won't go into those. I'll keep to the where it's been well established. That evidence is being used, I think, in terms of the big picture. You know, we have created scenarios. We can use epidemiological studies to make the point for what are the global policy changes or national policy changes which are needed. So I think there we're quite happy with the level of evidence that we have, which is enormous. It's, it's over 70,000 papers that have been published on that. Where I think we are still needing is, that's the evidence that exists. Where we're needing is the evidence of what people really need and feel it's important, and things that are happening in your doorstep and which aren't to do with air pollution or the policies that create air pollution, but they are not yet heard necessarily by governments or by the private sector or by different people. We will talk about it, but there's various levels of evidence that you need. I mean, you need evidence on the sources of air pollution, for example, to be able to focus your action. But often that gets recruited or limited. The action on that gets silent, and people will be happy to promote electric cars, for example, because that's on the interest of industry and jobs, etc. You know, it's in somebody's interest, which is fine. What we don't have is the connection around these different silos. And I think that's where the local level and activism has a role to make their voices heard, because certain priorities are already there, primarily what's in the government's agenda, what would win elections or what will provide money for the private sector. I think those things are already heard and already there. I think there's a lot missing, and that's where I think other coalitions in civil society can help bring the voice and create mechanisms for accountability, for example, about the kinds of impacts which are important for people or for the average people, rather than for people who are in certain positions of power in government or in private sector. So that's where I think we're still have to create.
Thank you, Carlos. And this, Rosamund, I think this nicely kind of like moves into what you would have to share with others on your advice on what kind of evidence do you think actually works in order to make people take action?
I think there needs to be a public health campaign. People need to, the coroner actually pointed this out. There is a lack of awareness, and also there's a lack of monitoring all over the world. When I've looked into this, there are countries where there's no monitoring at all. And it's about education and letting people know the air they are breathing in. And governments up until now have been quite reluctant to do so. It's not that we don't know. As Carlos said, there's about 70,000 papers, but there's more of a lack of will. And also, let's be very honest, it's very expensive. We are now, you know, as I sit here, we're having to change vehicles. You know, everything, we need to get rid of the combustion engine, and we need to move towards electric vehicles. This all costs money. And every time I search under this, I come up with the same thing. It's to do with money, it's to do with fossil fuels, and there's a lack of will from governments. It's not that they don't have the evidence. Carlos has very clearly pointed out, you know, cardiovascular disease, strokes, dementia. And I repeat again to governments, if you clean up the air, you'll be saving yourselves a lot of money. But not just that, let's focus on humans. We are living longer, and what that ultimately means is the quality of some people's lives are not great, especially people from poorer communities all over the world, because they are the ones that air pollution is impacting the most. So I can't accept that we don't know. We do know, but it's the lack of will. We are looking towards governments as we head to COP26. We want bold action from them. We don't want rhetoric. We don't want greenwashing. And I repeat again, and it may not be popular with some, that unless you clean up the air, climate change is never going to be resolved. Air pollution is, linked to acid rain, biodiversity, human health, global warming. So unless you clean up the air, we are going to be going round and round in circles. But not that. 8.8 million people die every year prematurely. Now we know that governments can act when they want to. That's what COVID has taught me. So I am no longer going to be accepting any excuses. Look at how they poured, I commend them for getting together to produce not just one vaccine, but many vaccines. So I know when they want to, they can do. What is the difference between air pollution and COVID? COVID can shut down economies, but air pollution doesn't. And that's why there has been a lack of will, nothing else.
I couldn't agree more with you, Rosamund. I think it's interesting to see like how the pandemic or the COVID pandemic has taught us that when there is the will to do things, people just move ahead and do things. So there's no excuses to not doing something around clean air. Or are we waiting until we get like another pandemic due to the quality of air that we're getting? And this is something that we need to address soon. But I also, before going on with this conversation, I do want to remind all of our participants, and especially for those who are joining us from Brazil or any other Spanish-speaking country, we have translation available. So please make sure that if you want to access the translation, there's a little button that should allow you to listen to the translators, to the translation immediately. Anyway, let's move on into a more optimistic way of seeing what we can do. And I know that both of you know about some solutions that have already shown results. So Rosamund, from your work in London, what kind of solutions have you seen are working? And what would you advise participants who are joining us today?
Well, in London, I don't know whether people know, but we were the first city that brought in the congestion charge. And what that has done is it has restricted certain vehicles for going into certain areas, or the mayor of London has brought in a charge. And what this has done is this has lessened the vehicles. Also, I have to say the vehicles now have got cleaner. And I'm sure we can all sit here and admire during COVID when there were no vehicles out on the road. We all saw what happened. In London, nitrogen, the dioxide went down by 70%. And it's just been quite heartbreaking to watch as the economy opens more and more and more and more, and there are more vehicles on the road. We've seen a return to air pollution. So the simple answer to that is we need less cars on the road. There is no way around it. We've also identified a source of air pollution is with wood burning. And I know in some countries they may use it for cooking and things like that. But we've noticed PM 2.5, the source seems to be wood burning. So yet again, that is something we can do there. So fossil fuels really are killing us. And the evidence is very clear. And it's not just producing electric vehicles, because if we replaced every vehicle with an electric vehicle, we're still going to have congestion. So overall, we need to drive less, and it is good for people's health. We need to walk more. Lots of us during the pandemic picked up walking, and we need to continue to do so. Electric vehicles are part of the solution, but they are not the be-all and end-all of the whole solution. And, you know, I always get told off for not mentioning wood burning. So I have mentioned it for today. So I hope everyone is happy that I've brought up wood burning. I see Carlos is smiling there.
Yeah, maybe Carlos, maybe you want to share some of your experience. We recently had a long talk with Carlos, who was telling me about his own experience, because I was asking him about wood burning, actually.
Aha.
So Carlos, maybe you want to share your thoughts on that as well, but especially we're willing to hear more around solutions. What are the things that you think have worked around the world in order to really kind of reduce emissions and really improve the quality of air?
Yeah, thank you. And I think the points that Rosamund was making are obvious and very important. You know, sustainable transport, walking and cycling spaces like the clean air zones have allowed to create, are essential. So if you take children, you see there's studies that demonstrate if you let cars close to schools, children learn less. If you make the cars to go away, if you plant trees, for example, if you create spaces where people cannot drive to drop their kids at school, this is in Barcelona, then their learning improves. So it's not like it's, a magical solution. It's pretty straightforward, and it's a matter of people who have decided to measure that. And I do value very much the work that has been done in Barcelona, systematically looking at ways that children walk to school, what is the levels of pollution that they're exposed, how can you reduce those exposures, create clean spaces for kids to walk to school and around schools, for example. That's very important work. But one of the things that I think I'd like to bring up is that we have history and have experience in many places, which sometimes is not, we have done great stuff on clean air. I mean, coal was the source of heating for houses for everybody, including in the UK. And in the 50s, this was eliminated because of public pressure, because of the medical evidence. So it's not that we haven't done some major changes, we have. It just takes a very long time to work around the interests of the vested interests of people who are invested in, just earning money with coal. It's still very difficult to get rid of coal as a source of power in many places. And coal is the main source of exposures of some heavy metals, of mercury in individuals. Is not, some occupational risk. It's really coal burning in coal-fired plants that exposes people to mercury, which is a very damaging chemical. So I think we should take stock from experience and what Rosamund was saying and the experiences in Europe, for example, in developing sustainable transport, cities which are more walkable, which are more, spaces, clean spaces and open spaces for children, which are safe from the point of view of injuries, but also from the point of view of air, are very, very important. This was not acceptable in Europe when I started working with sustainable transport in the 90s. Everybody used to laugh at me at WHO saying, oh, cycling and walking are not means of transport, that's nonsense. And the ministries of transport today are all engaged in the idea of creating walkable spaces and integrating cycling into sustainable transport, etc. So things can change. What matters is where is the pressure for change coming from and how much different groups can articulate their actions to create that change. So I think learning lessons from how do you create those spaces is very important. The difference with AIDS, I'll just bring that because this was very important in the, when AIDS happened, everybody thought it was, some disease of whatever. I mean, that's various classifications. But the fact is the articulation of different civil society groups, primarily gay men in the US, so, who were privileged, were instrumental to change the vision, the perspective, create the acceptability that patents could be broken. So a few individuals and a few institutions do make a very big difference. So I think in air pollution, still it's seen very much as an environmental thing. And as Rosamund was saying, where's the health sector? You know, I know WHO is very active, and I was part of that crowd some time ago. But, you know, health systems are still a long way away. You know, air pollution is part of NCD's prevention, you know, in principle, but the actions are really limited so far. So I think what we have is to create those models to learn from those experiences. For example, in the fuel burning, solid fuel burning, both coal and wood. There's a lot of effort since the 1950s which have gone in creating some sort of simple, clean cook stove, which doesn't exist, we know today. So what we do have to give is good technology, which is accessible to people who need it. And I think India is showing the way very well. They're making clean gas affordable or more affordable to poor people so they can implement it. Well, that requires government decision, but also requires scientists coming together with local people and understanding that, you know, some potentially good solutions perhaps don't work. So you do really have to go to the grassroots to learn the lessons from the grassroots and to be able to create those understandings. Solutions don't get created only in Washington or in Brussels, you know. I mean, they're very helpful in many ways, but the local evidence and civil citizens science, for example, I think are fundamental to create the kinds of knowledge and awareness that we need of what's needed at the local level and what works and what doesn't. So a long response, but I think there's lots of lessons to learn and a long way to go. Because although the scientists have been creating good analysis and that sort of and we'll hear from C40, and you know we've done that in WHO, urban health initiative scenarios, etc. Very important for the private sector, for governments to understand. But where is the evidence from civil society in terms of what is working at the local level? What happened in Barcelona should be happening in many places. I think in London, people in Lambeth have been doing some very beautiful work on equality at the local level. So we need much more of that kind of stuff to be able to articulate response and put pressure. So I think that's information for pressure and for accountability is where we should be focused on.
Could I just quickly add that
Sure.
Yeah, the coroner came up and said medical doctors need to also be educated on this topic. Part of the reason why my family found themselves in the situation which they did is we were not warned about air pollution. And it's not a criticism of Ella's doctors, but to say now, Stephen Holgate, who was the main witness in my late daughter's case, is doing phenomenal work educating the professions. I see this, and it'll be interesting what Carlos thinks about this. It's similar to the situation with smoking and the tobacco years ago. I see a lot of similarities, and I do think the professions will come through ultimately, and things will change. I don't know how you feel about that, Carlos, but that's how I sort of read the situation.
Absolutely, I think there's many parallels. And you know, where I come from in Brazil, there was one doctor which was really the pioneer of the tobacco smoke, etc. He was a very important person, but he was a bit of a loner, right? He was a bit of a activist kind of person. And what makes really a difference, and that's very important to have those, in Stephen Holgate and your work is very crucial in sort of changing the mindset of the medical profession as well. But we're still at the stage where that hasn't become mainstream. It's not part of, the tools that you have when you're seeing sick children, for example, or even NCD's patients, with some notable exceptions. So until it becomes mainstream, it won't be part, and we will operate in the health sector very much according to standard procedures, standard operating procedures. We cannot reinvent therapy every time or diagnose every time we see a patient. So it's still, we haven't gone there. And that's a space where I think a coalition or a connection with the health sector would be really important. I think what the case of Ella and Stephen Oldgate's point, even in it was very important to create that initial awareness. I think the other sector is education. Schools have not been saying we want clean air for our children. That makes a difference in the performance, in the learning. Schools should be cultivated, and I think that this is the kinds of partnerships that perhaps we can start building at the local level. But very much, I agree that health sector has to go there.
I love what's happening here, because it's basically Rosamund coming from a very grassroots background, asking for more health workers and frontline workers and doctors acknowledging the impact of air quality. And the other way around, Carlos also emphasizing and highlighting the importance of having more civil society, also kind of like sharing the stories of what works and what are the very local solutions that people are willing to just kind of take action. So I think this is really nice, the way that we're seeing this. But I want to bring some additional thinking around what we do, because as you both know, the Bernard Van Leer Foundation really works with the very young children. So we're talking about babies, toddlers, and the very, very young children around the world. And most of the time we refer to the well-being of children in a school age. So Carlos, you were mentioning, yes, we need to have like stronger partnerships with the educational sector. But I wanted to ask you, do you know of any experiences that are either like including the topic of air quality on a much broader strategy, which includes like a different topic? Or would you have any specific advice when thinking about babies and toddlers? What could be done, like from a solution perspective? How could we deal with this very specific range of age? Carlos, maybe you want to go first now.
I'll borrow from Kurt Smith, who was a great researcher on household energy, who died already or recently, and who made a very substantial difference internationally on the research that he was doing. And what he was saying is that when you're doing prenatal care, air quality should be part of the package. I mean, we do advise and we give sort of some medicines and some advice about what the mother should be doing about breastfeeding, about this, that, and the other. It hasn't included clean air. So I think, and he was saying, give these mothers, as part of the package, a clean cook stove or a clean fuel, so she could cook with gas or with electricity or something which is clean. That in itself, because respiratory disease is such an important cause of infant mortality, and because air pollution is cause of half, indoor air pollution is cause of half of the infant mortality in developing countries. So that in itself would be a very major. So I think I'll start with antenatal care, because that's where it starts. You really should be creating the environment. And of course, you're improving the environment of the house. You also improve the environment for the kids who are already there, or for the mother, or for other people, or for the neighbors, because what burns in your house goes outside to the neighbor's house. So it's not that you're in an isolated bubble. We breathe the air which is in our air shed. And even internationally, we know that the Netherlands, for example, where you normally are, Cecilia, 90% of the air pollutants come from outside the Netherlands. They are imported, sort of thing. If you're in Delhi, 60% come from outside. So it's quite important that awareness of this early stage comes as part of the response by the health sector, also as part of the response for the early child development actors. I mean, people who take care of other people's children, for example, at very early age. I mean, they should also be aware of the impact of air quality in their homes, in their neighborhoods, in the public spaces where children are playing. And that should be part of that response, that overall response. And I think you're going the right direction by identifying air quality as a key issue. You're already working on public spaces for early child development. So I think that's why I think it's very much appreciated. I mean, it's very logical and very important that gets built into that. I suppose we can help with perhaps bringing tools. I think that Rosamund's experience is very important, and some other people's experience can be brought in, as Kirk Smith's, which I was just mentioned.
There are a lot of questions on the chat. So Carlos or Rosamund, please feel free to answer to any of those questions. But I'm just going to pick one which I find quite interesting from your experience, Rosamund. How can communities start voicing their concern more directly? What do you think has worked on your work on advocating for the topic that really allows communities to start voicing their concern more directly?
I think communities need to, and the coroner gave us a fantastic tool to go out in the world. They need to voice their concern about monitoring. Without monitoring, they do not know the air they are breathing. So yet again, that is the basics. They need to demand. It is their fundamental right to know what they are breathing. So communities need to ask their local authorities, depending on what country you are. Governments, districts, they are responsible for the air we breathe, and we need to demand to know what we're actually breathing in. And Carlos was mentioning babies and toddlers. You know, we mentioned vaccines, nutrition, and one of the things we don't mention is clean air. And from 0 to 10 is when most of the lungs are formed, and that will be where most of the damage happens in the early years. And we need to give, you know, mothers some very good advice to avoid very busy roads. Like Carlos said, you know, like cooking, making it sure it's clean. You know, in the UK, we're going to eventually get rid of gas. We're going to go electric, but people want to know. People are craving information. People want to know what to do, and we need to empower them with information. There is a lack of information there, and people feel powerless. They don't know what to do, and it's up to governments and councils and mayors to give people the information. I think one of the fundamental things is the advice that is given is to avoid incredibly busy roads. There are busy roads all over, but people need to find quieter roads and not go so much, because we found in my late daughter's case, it was all about exposure, what she was breathing in minute by minute by minute. That is what was doing the damage. So we must focus on exposure to air pollution. I do believe there's a lot more education that needs to be had about the damage, you know, the detrimental impacts on the body to do with exposure to air pollution. What is going on in the body when we are, you know, you're breathing in, you know, PMs, you know, PM10 or PM2.5, all these toxins, sulfur dioxide, you know, they do have, you know, the problem unfortunately is all these pollutants, they are invisible. So we have an invisible killer in our midst, and it is up to us as advocates and activists to let people know this is what you are breathing in. So it is a hard sell, but education, you know, from a teacher point of view, I will always believe in education, and I believe if you put the information out there, people will make the right choices. Look, COVID has showed us people care about their health. They care about the health of their children. They just need the information.
I agree, Rosamund, and this invisible killer, which is how you name it, I think it's quite relevant to just emphasize on that, because, you know, whenever I think about, like, people would hardly ever drink like a polluted glass of water, right? Like if you see a glass of water that's not transparent, you just wouldn't drink it. But when we're talking about air, we're basically all breathing polluted air, and we're probably not aware of what we're breathing. And I think that if we would know more, and if we would have a better education and relevant information on the effects of what's happening to this exposure to polluted air, probably our reaction would also be different. Carlos, one last question on my side. Could you say anything about, like, pregnant women and the effect of bad air quality on pregnant women?
Sure. It's the same situation as it is with the brain or with the heart. The particles are so small and they're so toxic because they carry a lot of a mixture of chemicals and heavy metals and pollutants. So they're so small that they cross the blood barrier. And so they go into the lung, they go into the brain, they also go into the placenta, they go into the baby's body, and they start affecting the baby before the baby is born. Because the baby breathes in a way, or his blood or her blood, have the blood, it depends on what the mother is breathing. So there's lots of, and that's why antenatal care is so important. The exposures that the pregnant mother is having are very important to determine the lung and the conditions later in life of that child. And as Rosamund was saying, there's all these studies who show the lung development and other kinds of development in children. If they're in a polluted area, they're bad. If they move into a clean air area, then they improve. So the body has conditions to recoup and to improve. So we just have to be able to create those. It's not that because it is polluted today to have a negative impacts forever, but it does start very much early. And I agree. It's about with Rosamund. I mean, it's about empowerment. It's information for. It's not only knowledge. It's knowledge to empower, to bring accountability, to create and generate action. And that requires a very specific determination and focus. If it is to create action, how is it that we can articulate those issues? How is it that we can articulate pressure for better public policies from governments, from private sector? How is it that we can create demand? There's also, a partnership with social scientists there, in terms of understanding political processes and stuff to move things forward. So yes, governments are important, private sector are important, but the politics of it depends on a broad range of articulations of different partners. And I think there's lessons also from civil society movements, from gender pressure, from environmental movement that can be used, from AIDS advocacy, for tobacco advocacy that can be brought in to play in this sort of space. So I do think that the urban space is probably a space that we can create a lot of that. If air pollution is a soup, we have the counter soup, which is of articulation, political action, and pressure that can build to make those changes happen.
Thank you. So just as closing remarks, I'm going to ask you both, Rosamund and Carlos, if you can share, if you would like to make like a pitch to all the participants today of why we all need to take action on this topic. I would love to hear from you both in very 20 seconds, what would you be advising and why we need to take action now? So Rosamund, let me start with you.
We absolutely need to take action because we have found, or research has found, we can survive, 2 weeks without food. We can survive, 2 days without water, but we can't survive more than 2 minutes without breathing. It is fundamental. I loved the exercise in the beginning, which we did. We take breathing for granted. We've just spoken right now very easily. We didn't have to think, and we need to think about there are people who are constantly fighting to breathe. So we take it for granted, but it is a fundamental right, the same way water is, the same way food is, the same way shelter is. And it is up to governments. Governments have a duty, we mustn't forget that, to protect us. And that includes the air that we breathe. And I hope my daughter's legacy will be to raise awareness of this topic, and so that in future children won't have to fight to breathe. I live in a city that every year up to 12 children die from asthma. It is 2021. This is not acceptable, and it's never going to be acceptable in my books. And that's what it is, our right to demand it. And children have rights. It is their fundamental human right. Just because they don't vote doesn't mean we shouldn't take them seriously. So that's what I would like to leave us with for today.
Thank you, Rosamund. Super powerful. And thank you for being such a motivator on just taking action. I really think you are an example for us all. Carlos, your pitch.
I think Rosamund said it all, but I think if you can say anything else, is sort of gets together with partners at the local level to show what's positive from whatever decisions which have to be made in terms of transportation or energy or waste management, which are the sources of air pollution, to be able to justify that. But you have to look to build on the positives. I think the public spaces and how they are used are really key for our day-to-day and for our well-being. So I would put those bits together. What's better for local communities, and how is it that in terms of clean air, what is that could be created and can be created if you have some of those public policies from government, from private sector. So because we have to be able to see where the benefits for us and for our children, for our for our neighbors, and that I think is a motivator to have this articulation and have this interest really, an investment in creating change at the national, city, and global level. But it has to start with building partnerships, being with your local school, with the local health system. Those discussions and those conversations have to look at the local circumstance. I think to be able to build the pressure and the accountability mechanisms and the demand that will help change things.
Thank you both. It's been really inspiring, but also very helpful to just hear about very practical solutions. We always try our convenings to be a space where we, as I was saying before, we can create awareness about the importance of taking action, but also with the evidence that kind of allows us to confirm that there are different pathways to really kind of inform policy, inform actions that will work in the future. But thank you, Rosamund, and thank you, Carlos. I really like this conversation, and I'm sure it's going to continue inspiring the rest of our participants to take immediate action.